She's a pharmacist who didn't realize she was sick. But just when Heidi thought all hope was lost, she found a new reason to believe.
There is hope, and that's what I wanted to be able to convey to others, that there is hope.
Hope itself can be a powerful medicine, but Heidi Gross also has a lot of that on her side, too.
Yeah, our Dr. McGeorge is here with the story of Heidi's surprising diagnosis and a journey to fight a very dangerous disease.
Yeah, that's right. You know, Heidi Gross didn't feel sick. There was only one hint of the cancer that was spreading through her body, a hint that she admits she tried to ignore until someone refused to let her ignore it anymore.
And I kind of hit the corner of the countertop, and a big lump developed. It never bruised or anything.
It was just a hard bump into a bathroom counter.
I thought, this will just go away, this will just go away, this will just go away. It did not go away. And after about a year of saying this will go away, my husband finally said, if you don't go in and get that checked, I am going to make an appointment for you.
Heidi had surgery to remove the lump. It was tested, and the results stunned everyone.
It was malignant melanoma. And the doctor was very surprised himself to even be telling me that.
Melanoma, the most deadly form of skin cancer, and it had already spread. Heidi immediately focused on doing everything she could to beat it for her 2 daughters, 10 grandchildren, and John, her husband and high school sweetheart.
Being here for them and being here for John and continuing to grow old together, it means everything to me.
Deep breath for me, and out.
Heidi lives in Midland. Her doctors referred her to the Karmanos Cancer Institute, 2.5 hours away in Detroit.
Anything new symptom-wise for you since we saw you last?
It was there that she met medical oncologist Dr. Lawrence Flaherty. When traditional treatments failed to control the cancer, it was Dr. Flaherty who suggested a clinical trial at Karmanos.
When I heard the word clinical trial, that to me was almost worse than hearing the word cancer. It was the first time that I teared up in the office. I know I was almost panicked at that point when I heard that.
To Heidi, a clinical trial meant hope was fading. Not the case, says Dr. Flaherty.
Just the opposite. I mean, clinical trials are the engine for progress in the cancer field, so they're really the best option for care for a patient today. Heidi was fortunate enough to have a feature on her cancer that made her a candidate for some special treatment, and we were able to get her involved in a phase 1 study that involved 2 new drugs that are oral.
My test scans right away have come back that the areas are clear, the spots are not, they're gone. They are not showing up, they're gone.
Well, I think the story's still being written with these new drugs. We don't know how long they'll work and for whom they'll work, and we don't know when it's going to be safe to stop them.
She's always been a fighter. Whatever she's done, she will see it to the end. She's never been a quitter.
Life is too short to not try. Clinical trials are something that I would recommend now. There is hope, and that's what I wanted to be able to convey to others, that there is hope.
Now, doctors believe that Heidi's melanoma was caused by sun exposure when she was younger, and that it originally came from a mole that she had removed about a decade ago. Remember, prevention and early detection are still the best options, but clinical trials like this one are really giving hope to melanoma patients who once had very little.
And we should tell our audience that nearly 300 clinical trials are available at Karmanos, including 10 currently for melanoma. So Heidi's story is just one example of the great things that are happening there.
And this kind of work does require funding. One of the big events that helps advance and enhance that care is the Karmanos Cancer Institute's 32nd annual dinner, the event to be held this Saturday at the Fox Theater. Our own Hank Winchester will serve as MC. You'll find all the information at clickondetroit.com/health.
All right. Great story.
Thank you, Doc. Now here's